Okay, so good afternoon, everybody, and welcome back. So today we're going to be discussing microbial diseases of the genus urinary system. I believe that next week we have two classes, Monday and Wednesday, and then we're done. And of course, before the just let me check something. Can you hear me okay? Hello?
Yes, we can hear you.
I'm just testing. I just got a message say this is gone haywire. Anyway, as long as you can hear me. Obviously, microbial diseases of the genus urinary system are incredibly important, as you're going to see their real significance in a minute. They are really quite common, and they range from what essentially is nuisance to extremely dangerous. So let's have a look first at the actual structure, remind ourselves of the anatomy of the genus urinary system. First of all, urinary system, the kidneys, the ureters leading to the bladder, then the urethra leading to the outside, exiting through the urinary meatus. Now, the thing to realize about all of these systems, both the urinary systems and the reproductive system, is effectively they are tubular systems, and they have access to the outside. So this is really important because this means that there is a portal through which microorganisms can make their way into the interior of the body. So if you think about it, should bacteria be able to enter the urethra, they could, in fact, they potentially can make their way all the way through the urinary tract, right up to the kidneys. If in those cases where bacteria do make their way to the kidneys, it is extremely easy for the bacteria to move across into the blood circulatory system, for example. So these urinary tract, so things like urinary tract infection have tremendous potential for a serious pathogenic outcome. So the female reproductive organs, we've got a similar system. When I say this is a tubular system with a portal to the outside, that is exactly what it is. I'm not going to go through all of the details of the female anatomy, excepting to remind you that the vagina has really easy access to the exterior. The interior parts of the reproductive tract in females, not so much, because the cervix closes off the top of the vagina and effectively seals off the interior organs of the reproductive tract. But notice that the fallopian tube is actually open to the peritoneum. It's actually open to the peritoneal cavity here. And there is a possibility, if bacterial infection is set up in the female reproductive tract, it can actually trip over into a peritonitis and into a general widespread infection through the fallopian tubes. So again, it's a really potentially very serious situation. We'll hear about a particular instance where this occurs. Again, a tubular system, and it has access to the outside. Male system is similar, differs from the female system, though, in that there is no opening to the peritoneal cavity as there is in females through the fallopian tube. But it's a tubular system. It won't surprise you to know that actually males are somewhat less prone to infections of the genitourinary system. That's not to say they don't get them, they do, but they're somewhat less prone to infections than female. Now, in all of these systems, there is, to one degree or another, a microbiota already existing. Even the bladder itself is not necessarily entirely sterile. And we're going to find that in several instances, there actually is quite a rich microbiota, which again offers a protective covering. In addition, these systems are all lined with mucous membrane. And associated with that mucous membrane is specified lymphoid tissue, MALT, mucosal associated lymphoid tissue. So there is these surfaces are protected, specifically protected by the immune system. And it then becomes a battle between an invading pathogen and the immune responses. That in itself may be part of the cause of disease and disease symptoms, because these reactions of the immune system are inflammatory. And you'll realize that there's not a lot of room in these systems, especially in these tubular systems. If you think, have a look here at the vas deferens and everything in the male. Any inflammation there is liable to close that off. Same thing may be found in females in the fallopian tubes, those areas. Any inflammation may actually have serious consequences. Okay, so talking about the microbiota, the bladder itself may have a small population of resident bacteria. It used to be regarded as being entirely sterile, but it's now been shown that that's actually seldom the case. But because of the continual flow of urine, the continual movement of fluid through the system, the bacterial populations, if they are there at all, are kept extremely low. There seem to be some bacteria which are associated specifically with the bladder without causing any disease problem. The one area of the genitourinary system which has a very rich microbiota is the vagina. And in the vagina, the bacteria which have been best characterized in the vaginal flora are the lactobacilli. And lactobacilli are strongly protective of the vaginal environment. And they produce peroxides, they produce lactic acid, they lower the pH of the vagina, make it inhospitable to many pathogens. And they actually, it's been shown that their growth and their population is regulated by levels of estrogen. So they respond to changes in the menstrual cycle, for example, and flourish at those times when they would be most protective. There are numerous others that are associated with them as well, all sorts of things. And some of them you realize may actually arise from other sources. For example, E. coli and Proteus, these are actually gut bacteria, but they may form part of the normal vaginal flora as well. As long as they're in low numbers, this is not a problem. And in general, they are. The undisturbed, the vaginal flora is very diverse, but very stable. We even find things like Candida, and we'll hear about this again later. And this is something I want to point out. Candida albicans is a yeast, and it's when people say they're suffering from a yeast infection, what they're actually suffering from is an overpopulation of yeast. Not that the yeast has suddenly infected them. The yeast is actually part of the normal flora. It's when that normal flora gets disturbed that potentially pathogenic situations can arise. So the different parts of the urinary tract can have their own disease symptoms associated with them. So an infection and inflammation of the urethra is urethritis. That is very often the first sign of infection of the urinary tract. And it is noticed very, very quickly, especially in men, because it leads to painful urination. And very often that urethritis is as far as an infection will go. Very often an infection leading to urethritis may be self-limiting as well. It depends, of course, on what it is. Cystitis is an inflammation of the urinary bladder, and cystitis results from the migration of some pathogenic organism through up the urethra into the bladder, where it is able to settle on the bladder wall. Getting to really serious situations is ureteritis, and this is inflammation or infection and inflammation of the ureters. Now, this is getting really serious because this suggests, if there is ureteritis, that the infection is migrating. The infection is effectively moving, and where it's moving to is towards the kidneys. And an infection of the kidneys is called pyelonephritis. And it can be one or it can be both kidneys. And the pyuria part, the pia part, refers to the pain. It's a specific pain of kidney inflammation. And this can be extremely serious. As I mentioned earlier, this predisposes towards a bacteremia and then a septicemia, but it can also do a huge amount of damage to the kidney tissues. These infections of the urinary tract are very, very, very common. 8 million urinary tract infections noted annually, excepting this is not a notifiable disease, so that is probably a vast underestimate. And some people will treat urinary tract infections on their own, by whatever means, drinking cranberry juice or whatever it is that they believe will help. Many of these urinary tract infections are self-limiting. So, but I would say that really the hallmark of all of them is fever. If ever you have a urinary tract infection and it is associated with fever, that requires urgent medical attention. So the most common causes of these urinary tract infections are members of the Enterobacteriaceae, and they are the bacteria which are largely associated with fecal material. That should not surprise us, because the urinary meatus is so close to the anus, and that is especially true in women. So the source of infection by fecal bacteria is very, very close and very easy to establish. So it shouldn't surprise us that the two organisms which you see most commonly associated with these urinary tract infections are Proteus mirabilis and Escherichia coli, which you can recover from virtually any fecal sample. And on their own, they are in the gut, they are completely harmless commensals. But transported to this other environment, they can actually begin to exhibit pathogenic qualities, even if it is simply by exciting an inflammation by the immune system. So this the symptom of urethritis is unbelievably common, and it causes this burning sensation on urination is extremely disturbing, especially in men when it has become often very, very pronounced. Now, there are lots of different causes of urethritis. These are a whole list, and there are many more bacteria that will cause urethritis if they gain access to the urethra and are able to move up the urethra. You can recover bacteria usually within a centimeter or so of the beginning of the urethra. But the bacteria don't tend to move further than that unless there is some predisposing feature or they have the correct pathogenic mechanisms. So the common, as soon as somebody reports with urethritis, the very first thing that the doctor will examine for is whether or not it is caused by Neisseria gonorrhea. Gonococcal urethritis is very common and very distinctive. But its symptoms, especially early on, can be confused with urethritis caused by many other things. So the doctor will usually test, will take a sample, a smear, and will have it examined for Neisseria. That is gonococcal urethritis, and especially in men, it is often the first symptom of gonorrhea, which will send them to a doctor. But there are many other organisms can cause urethritis, and these are the non-gonococcal or non-specific urethritis. That is what it would be labeled as. And there are many of them: chlamydia, E. coli, Proteus, all sorts of things. And only some of them are sexually transmitted, chlamydia being one of them. The chlamydia trachomatis, we're going to hear a lot about. The rest of them are either, this one here, Mycoplasma genitalium, is actually a harmless commensal under normal circumstances, but it's on the outside. It's in the under the foreskin or in the folds of the labia or whatever. It's not usually, it is not clear what triggers a migration into the urethra. There's a couple of these we're going to hear more about, and trichomonas is another one that we'll hear about in a while. So urethritis, yes, in men, very pronounced. In women it tends to be rather more tolerant. I'm not sure of urethritis, and sometimes the urethritis will pass over in women, even though infection may be moving higher up into the urinary tract. Now, cystitis is inflammation of the bladder, and it has very irritating symptoms associated with it. Most commonly is caused by E. coli and Proteus again, which have made their way up the urethra into the bladder. And they cause the symptoms of polyuria, that is frequent urination, and dysuria, which is painful or difficult urination. And of course, this is often combined with ongoing urethritis. So this can be a very, very irritating, annoying symptom. And if it persists, it can actually become quite debilitating. Very much more common in women than in men. The urethra in women is much shorter than in men, so the bacteria don't have so far to go up the urethra before they enter the bladder. So if they've colonized the urethra and are making their way up the urethra, they end up in the bladder very much quicker than in men. In addition, the urinary meatus in women is so much closer to the anus that it's much easier to set up these infections. And they will take urine samples, etc., to check, and a diagnosis is greater than 1,000 colony-forming units per milliliter. Remember when we did our counting and everything? Here's a clinical instance where it becomes important to know the number. The reason we set a number is, as I said before, the bladder sometimes has its own resident population, which is just completely well tolerated and causes no problems. These can be difficult to treat. I wouldn't say that they're very difficult to treat. They are difficult to eliminate entirely. It is quite often quite easy to reduce the impact of infection, but discover that the population of bacteria has become resident and has set up a chronic situation. What is very worrying about these bacteria is that they actually are, many strains of bacteria are appearing which are resistant to the antibiotics which are commonly used. Now, if the infection moves all the way up to the kidneys, this is an extremely serious situation, which can have long-term permanent sequelae in kidney damage. So, again, look, the commonest cause: E. coli, Proteus, exactly the same things that are causing the urethritis, cystitis, etc., etc. And but this is marked by distinct pain. Kidney pain can be absolutely debilitating. And it's very often pyelonephritis will result in bacteremia. That is the actual dissemination of bacteria into the bloodstream. And it can also lead now to these conditions, sepsis and septic shock. Now, I've referred to this before. Sepsis and septic shock refer to responses of the immune system to the presence of bacterial components in the bloodstream and the body fluids. I'm not going to go into it in any great detail at the moment because we will cover this when we talk about bacterial disease and the cardiovascular system. I'll simply tell you that this is septic shock, especially, is a medical emergency which arises as blood pressure crashes in response to an immune overreaction to the presence of bacteria. And that is a potential outcome of pyelonephritis. But even if that doesn't happen, the formation of scar tissue and damaging of the kidneys may be so severe that a kidney may lose a tremendous amount of its function very rapidly once an infection like this has been set up. It predisposes people to all sorts of things, to kidney stones, to kidney malfunctions of all different kinds, metabolic malfunctions. So this is a really serious situation that has to be medically dealt with extremely carefully. The drug of choice is cephalosporin, but again, one just has to hope that the bacteria you're dealing with are not actually exhibiting any resistance to the antibiotic. Here is another count: 100,000 CFUs, colony-forming units per milliliter with a single species is almost entirely diagnostic of the disease. Okay, so now let's have a talk about sexually transmitted diseases. Politically and scientifically correctly, we are supposed to refer to these now as sexually transmitted infections, STIs, not STDs. STD is deemed to be somewhat pejorative, but I will fall down the whole time because I'm just so used to talking about STDs. I'll try to refer to STIs. Sexually transmitted disease, sexually transmitted infection, the names say it all. It tells you exactly that these are diseases which are transmitted from one person to another through sexual activity. And they tend, but it's not exclusive, because we're going to hear about one important instance where it's not. They tend to be associated purely with a disease status, which is itself sexually transmitted. What I mean by that is that the disease is only caused by being transmitted sexually. You don't catch it from a fomite or anything like that. The disease is exclusively associated with sexual activity. This is not always the case. We're going to hear at least one very important instance where it is not. But here's a couple of things to say about sexually transmitted infections. They are incredibly common. About 1 in 5 people in the United States suffers from either has or has suffered from a sexually transmitted infection. One of the dangerous things is the reproductive tract in both men and women is complex, and it has many areas where infections can be set up and can remain silent, and an infection can become chronic. And the implication of that is not only that the person is being exposed to potentially damaging situation, but that they remain infectious, often without knowing that they are infectious. so they can spread the illness widely. So very often, especially after an initial period of infection, STIs can become completely silent and have absolutely no symptoms. This is especially true in women. And that can have important consequences, not only for sexual partners, for the person themselves, but in women, it can have serious consequences for their offspring, because the offspring become exposed to organisms, especially during the birth process, if they're born by vaginal birth. Currently, about 20 million new cases of sexually transmitted infections are recorded in the United States annually. We have quite accurate figures because many of these illnesses are notifiable. That is, the doctor is required to keep records of how many patients they're seeing with these infections, and that is submitted to the Center for Disease Control. The vast majority of these infections, of new infections, occur in the young. That is absolutely unsurprising, and 15 to 24-year-olds. And over the last 25 years, we have been seeing a marked increase year by year in the number of sexually transmitted infections. And one of the reasons, there are many reasons for that, but one of the reasons for that is believed to be that the widespread use of safe sex practices, which became extremely well publicized and very commonly discussed in the 80s, in the 1980s, the 1990s. Once effective treatment for HIV was developed, the public health initiatives exhorting people to use safer sex practices and especially to use condoms has stopped, and people are just simply forgotten that they need to be observing safe sex practices. Condoms can prevent most of these sexually transmitted diseases, and their usage really needs to be encouraged, because as I'll show you, just have a look here, and now this is I think to 2018, which is about the latest data that they would be ready to graph, I suppose. Have a look at this graph, and this is the numbers of this is a whole range of sexually transmitted infections, syphilis, gonorrhea, chlamydia, and then various other sexually transmitted things which we may or may not mention. But have a look here. There you can see the impact of the 1960s sexual revolution right there, and then relatively stable. These dips and things here are because of public health activity, because of fears of HIV, kept the rates relatively low. But since the mid-1990s on, there's just been an exponential increase in sexually transmitted infections in the United States, and that continues. There is no difference the last couple of years. This is extremely worrying, because this not only are these diseases dangerous in themselves and do a tremendous amount of damage, but you need to think that associated with this, people are also exposing themselves to HIV, which has potentially lethal outcomes, even though we do have good treatments for it in most instances. So these are the commonest sexually transmitted infections in the United States. The first is this strange organism called chlamydia, and about 1,750,000 total cases since 2018. These are CDC figures, by the way, and these are relatively recent. Gonorrhea, they've recorded over 500,000 cases since 2018. syphilis. Syphilis used to be considered as a disease which was on its way out, which was going to become extremely rare, but it has resurged. And that is largely because syphilis is exhibiting many different resistances to antibiotics. So, and it is resurging in the population, over 100,000 cases in 2018. So there it is, total for 2018, 2 million, close to 2.5 million cases of sexually transmitted infection in that year alone. So these are diseases of enormous impact and of enormous importance in public health. And one of the main reasons for that, unfortunately, we always come down to this, but look at the cost. These cost nearly $16 billion a year. And this is direct medical costs. This does not taking into account the economic costs of lost time, lost productivity, and everything else. 1 in 5 people have an STI. There's nearly 68 million total in 2018. And half of the new STIs are in this age group, 15 to 24. Obviously, because they become exposed very, very soon after they commence sexual activity during puberty. So we need to understand some of these. So here's one of the very commonest. This is gonorrhea. And gonorrhea is caused by this organism, Neisseria gonorrhea. And here it is here. And typically, it is a diplococcus, 2 little cocci joined together. Now, that is characteristic of the genus. And you've heard about this genus before because we talked about Neisseria meningitidis, which causes meningitis. Looks very similar to this. And they're unusual because they're a coccus which is gram-negative, one of the very few gram-negative cocci. Again, it's just follow. If you go to the gonorrhea figure incidence, it just follows the same track as everything else. Since the mid-1990s, there's been almost exponential increase year by year in the number of cases. It is a disease which not only causes a painful infection in and of itself, it can have serious consequences in both males and in females. And what it does is it attaches to the surfaces of the mucous membranes. Here you can see, so these are all these diplococci attached to epithelial cells. And it excites a very strong immune response. It causes an inflammation of the tissues. It's pyogenic. That is, it causes pus to form. And this is one of the characteristics of the disease. And I don't know if I've got it. I think I've got a picture later on. But it's especially in males. This is one of the characteristics is they produce a pussy discharge from the penis. In men, there are kind of 2 things that can happen. The one is, the first, in men, it tends to be noticed very, very quickly because it causes a profound urethritis. But even so, sometimes in men, they either ignore it or that is a minor symptom. And the organism can move higher up in the reproductive tract and end up causing setting up a long-term infection with resultant sterility. But generally in men, it's noticed extremely quickly. In women, it is not noticed that quickly, very often, because it often becomes resident in the vagina. And while it may cause a discharge, there are many things which cause vaginal discharge. And women are often tolerant of that discharge. They deal by cleaning vagina, etc., unaware of the fact that they have a resident infection with gonorrhea. You can also have gonorrhea of the mouth, the throat, pharyngeal gonorrhea, and you can have anal gonorrhea, depending on what the sex practices of the particular person are. Oral sex, unprotected oral sex, can and very frequently does result in gonorrhea of the throat, and it causes a painful pharyngitis. Anal gonorrhea is something which is really important because it actually can pass by with very few symptoms, and yet be present and be a source of infection, particularly in people with multiple partners. So again, this is another of those tracks. This is interesting though, because you can see, have a look here. This reached a peak here in the late 1970s, and guess why? Well, because the peace, love, and happiness and everything. We were all out having a wonderful time and not thinking anything of it. And the gonorrhea rates were just going through the roof. The various other STIs were also going through the roof. But by the 80s, from 1980s on, they began very stringent public health awareness campaigns, trying to get people to use condoms. And then, of course, once the AIDS epidemic started, it became routine for people to use condoms and to think about using safer sex. And the rate of gonorrhea plummeted. The incidence of gonorrhea plummeted to the mid-90s, and now we see the increase that I've already showed you. So this is a classic example of the importance of these public health campaigns. Public health campaigns and simple, look, using a condom is a hygiene measure. It's the equivalent of washing your hands after you go to the bathroom or something like that. It's a simple barrier method to prevent infection, and it works. They work incredibly well from that point of view. Okay, so now, as I've told you, in men, usually with gonorrhea, they at the doctor pretty darn quickly. As I say, if they don't, or if for example, they don't pursue a course of antibiotics properly, they knock down the initial infection, relieve the urethritis, but don't kill off the infection entirely. That's another instance where it can move up into the reproductive tract. In women, paradoxically, there are far fewer symptoms. And this is because only the tissues high in the vagina become infected. And the infection, as I say, they may have itching and discharge, but this often can be handled. It's not necessarily going to send them to the doctor. The problem is that the disease spreads higher into the reproductive tract. And this can have very serious consequences in causing inflammation of the tissues of, first of all, of the uterus, but then also of the fallopian tubes. And that's the infection of the fallopian tubes we'll refer to again later on. This can lead to a condition called pelvic inflammatory disease, where the tissues become so inflamed that they start to block the fallopian tube, predisposing women, for example, to ectopic pregnancies, affecting fertility, and ultimately maybe to a disseminated infection with Neisseria, which can lead to all sorts of other things. Systemic infections can produce endocarditis, infection of the heart, meningitis, and a reactive arthritis in the joints. So there can be serious long-term consequences. But in women, the one thing to really be concerned about, and one of the reasons why women are routinely tested for gonorrhea, for a hidden gonorrhea infection, is that if they give birth vaginally, as the child is expressed through the vagina, they become exposed to the organism. And this causes an infection, especially of the eyes, called ophthalmia neonatorum. And it's a very, very fast-moving, very dangerous infection of the eyes. Very often routinely in hospitals, they will treat a child with antibiotic eye ointment, just as a prophylaxis, just in case. Okay, so here, this is the typical discharge, gonorrheal discharge from the end of the penis in a man. And this actually has a name. It's called GLEET, G-L-E-E-T. And if were you to take a sample of this, be very, very easy, even in the doctor's office, to diagnose the presence of the gonorrhea organisms. Okay, so here's our next STI, and this is one you've probably heard about. This is chlamydia. Chlamydia is by far the most common, truly pathogenic STI. What I mean by that is it may be rivaled in frequency by the incidence of genital warts, of the infection by the virus causing genital warts, which is papillomavirus. But that is an entirely different issue. We've talked about it in the viruses. But for the bacterial infections, chlamydia is by far the most common. So it's a very strange little organism. It's an obligate intracellular organism. It only functions it only becomes metabolically active when it is intracellular. It really is a gram-negative bacterium. It's extremely small. It has one of the smallest genomes of all of the bacteria. And in order to cause an infection, it has to morph into this little infectious body called an elementary body. Now, that elementary body, when it impacts a host cell, it sticks the host cell and it induces endocytosis by the host cell. And once inside in that vesicle, this it transforms into what is called a reticulate body. And the reticulate bodies begin to divide, and they divide and divide and divide, and you can visualize them. You can see them here inside the cell, inside the host cell. And then at a certain point, the reticulate bodies begin to change. They metamorphose and form elementary bodies, kill the host cell, and are released as elementary bodies to go out and infect new cells. So the infectious particle is called the elementary body. And chlamydia is a very bizarre organism. And as we're going to see, it causes a variety of disease states. It's the very commonest cause of non-specific urethritis. And again, that is often the symptom which sends people to the doctor to be examined. But infection with chlamydia can also very frequently be asymptomatic. And this is especially important in men, because most other STIs very rapidly cause the urethritis. And chlamydia does not necessarily do so. It can, but it not necessarily do so. It can set up chronic residence in the urinary tract, in the reproductive tract, and it also predisposes people to infection with other organisms. So very often, people will present with multiple STIs. They're very commonly chlamydia and gonorrhea occur together. Sometimes gonorrhea, chlamydia, and syphilis even. Now, then it tends to be somewhat better tolerated in men, which is unfortunate because they become a source of infection. But in women, chlamydial infections can be extremely serious and chronic and quite difficult to deal with. And they they are a common cause of inflammation of the fallopian tubes and pelvic inflammatory disease, with a consequence that women may become infertile. In many parts of the world, in developing countries, chlamydial pelvic inflammatory disease is a major cause of depopulation of certain areas. In addition, there is an increased risk of cervical cancer. The exact reasons are not clear, but there is a strong statistical association between chronic chlamydial infection and cervical cancer. And in addition, the chlamydia can be passed from mother to infant. And remembering that in women, very often the chlamydial infection is completely silent, but nonetheless it can be passed to infants during a vaginal birth. And if a woman is sexually active, really, I would say anybody who's sexually active, especially with multiple partners, should be tested for chlamydial infection with regularity. But this is particularly important in women who are likely to give birth. It is certainly treatable. Again, though, there are resistant strains of chlamydia. So this is a chlamydia in the classic setting of a sexually transmitted infection. But chlamydia can cause other diseases as well. And in actual fact, the chlamydial infection is the commonest cause of blindness in the developing world. And this is a very strange situation, is because, as I warned you before, here is one of these sexually transmitted, one of these bacteria, which forms a classic sexually transmitted infection, chlamydial infection through sex. But the organism can also be transmitted other ways. And in actual fact, it can be transmitted just by the fingers. It can be transmitted by hand. And it can also be transmitted by vector, by flies. And so in situations of very poor hygiene, this exactly the same organism, Chlamydia trachomatis, can be trafficked to the eyes. And what it does is it actually sets up a chronic inflammation of the eyelids, and it causes the eyelids to invert, to turn inwards, and the eyelashes then begin to abrade the cornea. And this is the commonest cause of blindness in the developing world, is trachoma. That is the name of the disease, is trachoma. And this is now the subject of enormous amount of work by public health organizations, especially in Africa, because this is eminently preventable. First of all, by observing hygiene methods, and then second of all, by the use of antibiotic treatment, relatively simple antibiotic treatment of the infections in the eyes can produce a good outcome. Here's another disease state also caused by Chlamydia trachomatis. It's a very variable organism in the disease processes that it undergoes. This is called lymphogranuloma inguinale. And this is a sexually acquired chlamydia that has moved into the lymphatic system. And especially it becomes resident in the lymph nodes, and it begins to set up an abscess kind of inflammatory structure, which breaks through to the surface, often causing massive disfigurement and disability. Extremely serious. This is lymphogranuloma inguinale, still caused by Chlamydia trachomatis. Okay, so I just want to emphasize a little bit about pelvic inflammatory disease, because pelvic inflammatory disease is a curse of women all over the world, but especially in the developing world. And it results from the extension of bacterial infection into the uterus and then especially into the fallopian tubes. And very often there may be a mixture of bacteria or a one bacterial infection, say chlamydia or something like that, sets up an inflammatory situation which predisposes the woman to other infections which come in as well. And the commonest combination is either Neisseria gonorrhea or chlamydia or both in being involved in the inflammatory process. It can be very debilitating. Women can end up suffering from chronic pain, chronic disturbance of the menstrual cycle, chronic cramping, bleeding, etc., etc. And these are all symptoms of the salpingitis, inflammation of the fallopian tubes. And that constant inflammation causes scarring of the fallopian tubes, predisposing the woman to ectopic pregnancy. Now, an ectopic pregnancy is a medical emergency. Normally, what happens is in reproduction, of course, as you know, the egg is fertilized in the fallopian tubes. The fallopian tubes are lined with ciliated epithelium, and that moves the fertilized egg down into the uterus where it implants. The egg will, if the egg stays still for any length of time, and it's busy dividing, of course, if it stays still for any length of time, it will embed wherever it is. It doesn't distinguish between uterus. It's the movement of this fertilized egg which ends up placing it in the uterus. If you have a situation like pelvic inflammatory disease where those processes are now disturbed, the egg tends to stop in the fallopian tube and it will settle and begin to form a placenta in the fallopian tube. There is no room in the fallopian tube for any tissue to develop. And this forms what is referred to as an ectopic pregnancy. The egg is embedded, it's beginning to form its placenta, and the fallopian tube essentially is put under pressure. It's an intensely painful, very dangerous situation, because if that ectopic site bursts, it becomes a medical emergency, and women can actually die as a result. So in any case that where pelvic inflammatory disease is known to have occurred or to be an ongoing thing, this is something which is watched for very, very carefully. Pelvic inflammatory disease can be treated by a variety of antibiotics, but by the time this inflammatory situation has been set up, if it has run for any length of time, it becomes extremely difficult to eliminate the infection entirely, and certainly even a mild infection can have serious sequelae. Okay, so on to our next. We've done gonorrhea and chlamydia, which are by far the commonest, but now we need to talk about syphilis. And this is a disease which is caused by a bacterium called Treponema pallidum. It's a gram-negative and it's a spirochete. Here it is here. Remember, the spirochetes are those bacteria which are tightly spiraled. They have flagellum which is bound to the cell membrane down the middle here. It's a strange situation, but it produces a distinctive kind of movement, and that is that the bacteria spin on their axis, and the spirochetes are the only bacteria that can go forward and backwards. They can move like this, which is very characteristic movement. As soon as you see that, you know you're looking at a spirochete. So you need in your mind to distinguish them from the spirillum, which is a bacterium which has a lazy spiral in space, but the spirillum has flagella at the end. It doesn't have this tight corkscrew shape around the flagellum. So it's actually relatively easy to diagnose very early on in the infection for a reason that I'll show you in a minute. It's strictly sexually transmitted. You cannot acquire the syphilis from any other source. You cannot acquire the syphilis from a toilet seat or from a fomite of any kind. It has to be sexually transmitted. And the spirochete makes its way through minute tears in the mucosa, through skin breaks, whatever. And it induces an initial, very powerful inflammatory response, which, especially in men, is very easily identified. In women, it again may not be identified very quickly because it may take place high up. The site of infection may be high up in the vagina and hidden away. The woman may know nothing about it. So I'm just going to jump that and then come back to it. So here is the what one sees in this is in male, and this is called a chancre. This is a sore caused it at the site where spirochetes have entered through a break in the skin. This is absolutely painless. This is almost diagnostic of syphilis. Although this is an inflammatory necrotic response, there is no pain here. If a sample is taken there on the surface, which a doctor will often do, and to examine under a microscope, it is very, very easy to spot the spirochetes because they are very, very abundant here on the sore. So a person with a sore like this is incredibly infectious. And in men, they will often see the sore and report to a doctor, whatever. In women, this sore may lie high up in the vagina and not be noticed. And so that person may infect many people. This is a common situation, especially in sex workers. This sore will disappear after about 2 weeks. It'll disappear entirely with virtually no scarring or anything. And very often the person will think, if they didn't have it treated, they'll think, oh yeah, I'm fine. So we will return to that in a minute. Now there's another disease caused, there's some argument. There's probably by another treponema, but it's always been called treponema pallidum that causes yaws, which is a skin disease, a very nasty skin disease, which is transmitted. It's contagious, but not through sexual contact. But there's many people now think that this is an entirely different species of treponema. Again, syphilis, if we look at the figures, the numbers, these are figures, again, up until 2018. And look what we see. We see exactly the same, this increase that we've seen in all of the others. And I'll just point something out to you. You may be tempted to think that this is because we've got an increasing number of population. This is the importance of looking at an incidence. This is the rate per 100,000 people. So that's a ratio. So the size of our population is immaterial. It's the incidence that is increasing year by year. And again, 15 to 24-year-olds, this would be more than half of the population who are exhibiting these infections. So it's an extremely big public health problem because syphilis carries with it some very, very serious consequences if it is not effectively treated. So here we are. This is the first sign. This is what we refer to as the primary stage of a syphilitic infection. So this is the primary stage, is the chancre, which will occur in men and women, but which will disappear. And people may, once it's disappeared, people may think, well, they're okay. But in actual fact, what has happened is the infection has moved into the bloodstream and has become disseminated. And it makes a reappearance weeks to months later. It will make its reappearance, and this secondary syphilis stage is incredibly diverse in its symptoms. The commonest symptoms are skin eruptions, lesions that appear all over the body. And these are because of a disseminated inflammatory response, which results in these kind of lumps and bumps and pustules all over. So now people will even ignore this. And this also resolves itself and disappears. But again, the treponema is a chronic infection. And now, not months, but years later, it will reappear as tertiary syphilis. And by the time tertiary syphilis symptoms occur, there is really very little that can be done to help somebody. At both primary and secondary stage, it can be treated with antibiotics. And the antibiotics of choice are actually penicillin antibiotics, penicillin-based antibiotics. But tertiary syphilis can be extremely difficult to treat. And the reason for that is that what has happened is it's actually largely immune responses. One could almost think of it as being like autoimmune. It's like the immune system is now reacting against the body's own tissues to cause these terrible effects. This is called gummatous syphilis there, and it's these large abscesses and ulcerations that develop, not only externally, but internally on the organs as well. The other common effect of tertiary syphilis is that it attacks the arch of the aorta. You know how the aorta leaves the heart in the great arch? It attacks the aorta in that region and weakens the aorta wall and causes an aortal aneurysm, which is a weakening, a ballooning out of the weaker tissues of the aorta. A very, very, very dangerous situation, because if that aneurysm bursts, you die very, very quickly of hemorrhage. But the effect which people absolutely dread and have dreaded for many centuries is neurosyphilis. And this is a progressive impact on the nervous system, often accompanied by dementia, but also with a paralytic element to it. People lose the ability to walk and to move properly. Voluntary motion becomes distorted and uncontrollable. So I should tell you that for many centuries, syphilis was regarded with as much horror as we regarded HIV and AIDS, say, in the 1980s. People were absolutely terrified of syphilis, for it seems to have entered the European population perhaps in the 1100s or sometime like that. So its entry was actually a relatively modern phenomenon. This is what we believe. But it became incredibly common throughout Europe, especially, and throughout the Americas. It was imported, obviously, to the Americas. And of course, for almost its entire history, there has been absolutely nothing that could be done until the advent of modern antibiotics. And as I say, it's normally relatively easily treated in primary or secondary stage by the use of penicillin-based antibiotics. But accompanying this prodigious increase in the incidence of syphilis, there is also an increase in the number of resistant strains of the organism, which is very, very unfortunate. And there are now some strains of syphilis which are resistant to all but the most powerful antibiotics. So it's becoming very difficult to treat. It's a disease everybody who is sexually active should be very well aware of, and should, especially if you have multiple partners and if you are not observing safe sex practices, it is something you might want to be screened for with regularity during an annual checkup or whatever. Okay, just a couple of other things. Here's one of the things about the spirochetes is they're actually quite difficult to see under the normal light microscope. They're very, very thin, and they're just quite difficult to see. So what we do is we use a special microscopic technique called dark field. What you do effectively, what you're doing, instead of shining light straight through the specimen into your eyes, the light is shone from the side. So the background looks dark. The light hits the spirochetes and it bounces off, and you see them as a bright object against the dark background like this. So that's a dark field. But there are also many serological tests, and here's one of them. This is testing with an antibody, which is labeled with a fluorescent dye. So it reacts to the spirochetes, and you end up looking at it under ultraviolet light. They glow this characteristic color. So that is syphilis. Now, here's another a disease which needs to be very carefully diagnosed apart from syphilis, to distinguish it from syphilis, to distinguish it especially from primary syphilis, because it looks like primary syphilis. Very often people will present with these a kind of ulcers. Now, this is a chancre. It's also, remember that was the symptom of primary syphilis. But primary syphilis is completely painless. This chancre, which is called chancroid or soft chancre, is extremely painful. And it's not caused by a spirochete at all. It's caused by a gram-negative rod here called Haemophilus. We heard about Haemophilus once before, but another species, Haemophilus influenzae. It was an organism of our nasal microflora, which can cause a sore throat and can also cause a meningitis. This is Haemophilus ducreyi, and it's specific to this condition of chancroid. So again, they're extremely painful, and they produce also an associated painful lymphadenopathy of the nearby lymph nodes. And they can be really serious because the ulcers can break through at the lymph node. It can break through rather similar to that lymphogranuloma. So these need to be carefully distinguished from other likely things. This is Haemophilus ducreyi. So our next organism is not actually a bacterium at all. It's a fungus, and this is Candida albicans. Now, and this is a unicellular fungus, so it is referred to as a yeast. Yeasts are unicellular fungi. We have it widespread throughout the body as part of the microflora. It's extremely common. It grows in the mouth, intestinal tract. You can isolate it, but in very, very low numbers. And it's kept in check by environmental conditions and by the presence of all of the other bacteria and everything in the microflora. But it will grow as an opportunistic pathogen under special circumstances, especially where the microflora becomes disturbed for one or another reason. Often these days, it is often precipitated by antibiotic use. And when the Candida blooms, it causes inflammatory reactions in the tissues that it's on. It's very, very irritating, and it's often visible as a white film. And in those circumstances, it's called thrush or a thrush. And it can occur, for example, in the mouth, but it can also occur in the reproductive tract, and is common in women for them to have periods where the candida blooms, and they will then diagnose themselves or be diagnosed as having a yeast infection. It's not so much a yeast infection, it's more that a yeast overgrowth, and it's very often a temporary situation, but can be extremely irritating, produce an itchy, purulent discharge in women. Infections of candida in the urethra in men do occur, but they're not that common. Nowadays, you can actually treat this with over-the-counter medications. But the problem with over-the-counter medications is that you need to do them exactly as described, not just until you've relieved the symptoms and then stop. There's a real concern that resistant candida is arising, and could be a real problem. In healthy people with a normal functioning immune system, even bad yeast outbreak is more of a nuisance than anything else. It is not something that's likely to cause life-threatening things, but in people who have immune suppression, it can be a really dangerous component of the syndrome. In AIDS patients, for example, thrush could extend really literally from mouth to anus and completely distort the functioning of the entire digestive tract. Similarly, for patients in extreme situations like severely burned patients, the immune system is often really radically affected. Candida can be a really dangerous component to have to deal with. Oops. Okay, so the last disease, most of what we talked about was bacteria. We've talked about a yeast. Now here's just one more organism for interest's sake. And this is trichomoniasis, some people say. And you may have heard it referred to by its nickname, which is trick. And this is this single-celled organism here. It's a flagellate. Here you can see its flagella there. It's a eukaryote. So this is really a protozoan. It has flagella there, and then it's got a flagellum it's got on either side, a flagellum that comes down like that, that's tied to the cell. And so it's got to make like a membrane, like a swimming membrane on the side. And again, it can often be recovered as part of the normal microflora in very, very low numbers, but disturb the environment and it can suddenly bloom. And one of the things which keeps trick in control, under population control, is the presence of lactobacillus, producing lactic acid. The low acidity, especially of the vagina, keeps this organism in low numbers. And if you disturb the microflora, if you lose the lactobacillus, especially if, for example, overusage of douching, antibiotic treatment for something else, all of these things can disturb the normal functioning of that microflora and give trick an opportunity to bloom. And it causes a very distinctive, frothy, greenish discharge, which really smells really, really bad, can be really alarming. And it's treated with a drug called metronidazole. And metronidazole is commonly used for these protozoan infections, even in the gut. So metronidazole, those of you in nursing, you will frequently hear this referred to in treating of parasitic infections, for example, of the gut, but here it's used for treating trichomonas rather. Okay, I think that's it for today. Yes, it is. And so next time we move on to our next body part. In the meantime, are there any questions? If not, all right, I'll say goodbye to you all, and then I'll see you next week.
Thank you.
Okay.